At Progress Ranch, we provide residential mental health treatment to children ages 6 through 13. So we have about 50 staff on our team. It's a lot of people for 12 kids, but every single one of them cares about our kids. I think because it's really important that we focus our money on our kids and on the people who provide direct treatment and services and care for our kids. So we focus our funding on what we think will most benefit the kiddos, and what's left over isn't much. In fact, there's not anything left over. So the 100 men of Yolo County helped to fund the refresh, we're calling it, of these bedrooms. We had to take everything off the walls. We found holes behind, there was some board up on the walls. So we took it all down, patched everything up, put up fresh wainscoting. We tore out the carpet and put in fresh flooring, brand new bed, new mattresses, built-in. This was a built-in closet. So the IMD rule means that if you have more than 16 beds, without an exception being made, you can't get federal funding. The state, the counties can't get the federal funding match that they would get otherwise to have children placed with you. For us, that makes us not want to expand and offer more beds, which is really kind of sad because we had 8 children on a wait list for one spot last month. That's 7 kids that we couldn't serve. We've had kids who've waited in hospitals for us for over a month. We've had kids who've waited in shelters to have a placement. I get emails from people looking for places telling me their kids have been in our offices, social workers' offices, for weeks. The need is great. Our average stay is about a year at Progress Ranch. So we're hoping to get it down to about 6 months. Some kids will need more time, some will need less. And quite often it becomes a matter when they're ready to go, when they're ready to graduate, of where do they go to? Is there a resource family available for them? Because, they should be ready for a family setting. There may not be a family out there that their social worker can find for them, which is really heartbreaking. When they come and the understanding is, as I become healthier, as I be able to manage my trauma and I'm able to behave differently, then I'll be able to go into a foster family or back with birth family, which is of course ideal. If we can't keep that promise, that's really hard.